So when we talk about metrics, what they're measuring, I can give you, some of this is based on pediatrics, but it can be generalized to certainly other specialties, general internal medicine, other primary care areas, and as well. Simple, very simple things. Are the patients coming in for their checkups as they're supposed to, so that the payers look at how frequently are they coming in for their checkups. They look at immunization rates. Are the children getting all of their immunizations at appropriate times? They look at screening tests, vision screening, hearing screening. They look at right now, or recently, there's been a new recommendation of lipid screening, for instance, in all either late school age or young teenagers. So are we doing our lipid screenings as recommended? There's been a recommendation to do chlamydia screening on all sexually active adolescents. So that are we documenting that? And that's the real important piece of all of these metrics, and the real important piece of PCMH is you can't just do it, but you have to document it, and then you have to be able to write a report to show that you're doing that. When we were applying for our patient-centered medical home application through NCQA, we had to set up baselines on what we were doing up to that point. And then what we're doing is we're picking certain parameters to show improvement over a period of time. And we'll be measuring our improvements every 3 months or so. So how we keep track of this stuff is really critical, and there's different ways of doing it. Initially, we would just use paper for registry. We just keep a list of patients and, just follow it with paper. What we're doing now, we're upgrading our EHR system, and we have a full-time IT person in our practice who is working with the EHR company in generating reports. So that becomes really critical. The other thing that's been really important in implementation is that when we first started doing this, we put together a spreadsheet, and I have an administrative team that I work with, and we can talk more about how you set that up. But we have a spreadsheet, and we meet every week, and we go through the timelines in the spreadsheet to see how are we getting things done, how far along are we on it. And some things are easier and some things are harder. And just like anything else, you may try one way of doing things, and that may or may not work, and then you massage it and you try to make it better. And so it's an in-process kind of situation.